if you've been diagnosed with mesothelioma and your pathology report mentions a BAP1 or BAP1 mutation, or if genetic testing is being recommended, you probably want to know what it is and what it means for your treatment and prognosis. BAP1, which stands for BRCA1 associated protein 1, is a gene that, when mutated, appears in some mesothelioma patients, and it has important implications. Today, I want to explain what BAP1 mutations are, how common they are in mesothelioma, and what they mean for your prognosis and your treatment. I'm Terry Oppenheimer. I've been writing about mesothelioma and asbestos for the website mesothelioma.net for over a decade. I'm not a physician or a genetic counselor, and this is not medical advice. But understanding BAP1 mutations helps you interpret your test results and make informed decisions. So let's start with what BAP1 actually is. It's a tumor suppressor gene. That means it normally helps prevent cancer by regulating cell growth and repairing damaged DNA. When BAP1 is functioning normally, it acts as a brake on uncontrolled cell division. The mutation means the gene is damaged or altered so it can't perform its normal tumor-suppressing function. Without this protective brake, cells are more likely to become cancerous. Now, BAP1 mutations are somatic. They occur in the tumor cells themselves, and they probably develop during your lifetime, possibly as a result of asbestos exposure rather than being inherited. These are acquired mutations specific to this rare form of cancer. How common are they in mesothelioma? Studies suggest that 5 to 14% of mesothelioma patients have BAP1 mutations in their tumors. The exact percentage varies depending on the study and the population being examined. Now, before I get into the rest of this, which is very detailed, I'm going to take a break here and ask you a quick favor. If you find these videos helpful, hit the like and subscribe buttons below. It makes it easier for other people who need this information to find us. And if you have questions or there's a topic you'd like to see addressed in a future video, send me a note in the comments section. And make sure you watch until the end, because I'm going to give you valuable information on where to find resources that will really make a difference for you. So, what does a BAP1 mutation mean for your prognosis? This is where the research becomes very interesting and somewhat counterintuitive. It would make perfect sense for a mutation in a tumor suppressor gene to be an indication of a worse prognosis. But for mesothelioma, the exact opposite appears to be true. Multiple studies have shown that mesothelioma patients with BAP1 mutations have significantly better survival than those without. Some studies show a median survival of 4 to 5 years or even longer for BAP1 mutated mesothelioma, compared to under 2 years for patients whose BAP1 gene is normal. 5-year survival rates in some studies approach 50 to 60% for BAP1 mutated patients versus 10 to 20% for those without the mutation. This is a dramatic difference. In fact, the BAP1 mutation appears to be one of the strongest positive prognostic factors in mesothelioma. Why would a cancer-causing mutation lead to better outcomes? It's a paradox that researchers don't fully understand, but several theories exist. One is that BAP1 mutated tumors might grow more slowly, giving patients longer survival even without treatment, while others think they might be more sensitive to treatments like chemotherapy or immunotherapy, which would lead to better responses. Other researchers, they've suggested that the mutation might be associated with the epithelioid cell type, which already has a better prognosis than sarcomatoid. Alternatively, BAP1 loss might trigger immune responses that help control the cancer. The exact mechanisms are still being investigated, but the clinical observation is clear. BAP1 mutation is associated with significantly longer survival. Does BAP1 status affect your treatment decisions? Currently, BAP1 mutation status doesn't change standard treatment recommendations. Patients with or without BAP1 mutations receive the same chemotherapy, immunotherapy, and surgical approach recommendations. Still, knowing you have a BAP1 mutation provides important prognostic information. If you're making decisions between aggressive treatment and more conservative approaches, knowing you have a favorable prognostic marker might influence those decisions. Some clinical trials are beginning to split patients up by BAP1 status or are looking to specifically enroll BAP1 mutated patients. As research advances, there's a good chance that BAP1 targeted therapies will be developed. Should you get tested for BAP1 mutations? Absolutely. If you have mesothelioma, BAP1 testing of your tumor tissue can provide valuable prognostic information. Many mesothelioma pathology evaluations now routinely include BAP1 testing along with other molecular markers. But if BAP1 testing wasn't done on your original biopsy, you can request it. The pathology lab needs tissue from your biopsy or surgery, so it's easier to add this testing to initial pathology than to do it later. When your physician orders your biopsy, don't hesitate to ask whether BAP1 status is being tested. And if the answer is no, request it. Are there other genetic mutations relevant to mesothelioma? Yes. The most studied is NF2 mutations occur in about 20 to 40% of mesothelioma and are generally associated with worse prognosis. CDKN2AB deletions are common and associated with aggressive disease, and TP53 mutations and other genetic alterations are being studied. None of those results are as clear as BAP1. Still, comprehensive molecular profiling of mesothelioma tumors is increasingly common and could identify mutations that could be targeted with specific therapies or that provide prognostic information in the same way that BAP1 does. Should everyone with mesothelioma get comprehensive genetic testing? It's becoming more common, and it can provide useful information. So discuss this with your oncologist. See whether molecular profiling makes sense for your situation. Some oncologists routinely order it and others use it more selectively. What questions should you ask about BAP1? Start with asking whether your tumor was tested for the BAP1 mutation, and if so, what the result was. Ask how your BAP1 status affects your prognosis and whether it changes your physician's treatment recommendations. To review, BAP1 mutations occur in 5 to 14% of mesothelioma tumors, and counterintuitively, they predict significantly better prognosis, a median survival of 4 to 5 years versus under 2 years for BAP1 normal disease. BAP1 testing of tumor tissue provides valuable prognostic information. You can visit mesothelioma.net for more information about BAP1 mutations and innovative treatments for your disease, or call 1-800-692-8608 or use the live chat feature on the website to speak to one of our patient advocates right away. As for me, remember to post your questions below, and I'll see you next time.